Hi there, I'm M Lashewicz. I'm part of the Community Rehabilitation and Disability Studies program, nested in Community Health Sciences here in the Cumming School of Medicine at the University of Calgary. We are a social justice-driven program, meaning that we are aimed at challenging power hierarchies. We are aimed at elevating voices that have been in some respects silenced or marginalized or more difficult to hear. As part of Community Rehab and Disability Studies offerings, these include a robust undergraduate degree program. We also have a course-based master's program where we train people to be leaders and policymakers in our field. And then, of course, in addition, we have MSc and PhD research track programs. I want to give you just a small sample of the wonder and excitement of research in these realms, and of course that relates very much to the corresponding course offerings we have. We're concerned with, stated simply, we're concerned with people who have labels. Those may include developmental disability, mental health disorder, or other hosts of chronic conditions. We are concerned with people across the lifespan, so early development, school years, residential, vocational sort of stages of life, and also into long-term care and issues and experiences people have with aging. So to illustrate, I am wanting to tell you a little bit about a project I'm doing with adults who have diagnoses of developmental disabilities. And I've just got a pair of very handsome shoes sitting on the table beside me, meaning I'm sock feet. And I want to say that I've purchased these shoes from a place of employment where a person who is part of my sample group works. And as part of that work, I'm practicing very much a sustained, intense sort of a researcher engagement, very drawn to representing and, of course, capturing the complexity and multi-contexts within which people live their lives and make decisions. And so this was part of data collection where we were at the woman's home, we were at the woman's support providing agency, and later we were at the woman's place of employment. We're doing video analysis as well as audio analysis, so we're examining the content of what is being expressed, but probably more excitingly, we're examining the way in which expressions are playing out. So how many voices are important to understanding whose voices those are and how those are collected are very important to us. We're looking at vocal and non-vocal, non-verbal, all sorts of communication expressions. And therein, we're illustrating just how very talented and competent people who have diagnoses are. And we think we're raising that into profile that will have important implications for practice, helping service providers, professionals to better understand and respond to people, as well as informing policy correspondingly. And then, of course, building exciting methodological and theoretical developments in terms of social justice-oriented research and scholarship that is about capturing the fullness of voices. If that appeals to you, we would be delighted to provide information. My colleagues are doing a whole host of their own exciting work that crosses a really wide spectrum, ranging from abuse and violence, homelessness, incarceration, science, technology, later life, patient-driven care. I just don't have enough time to give you the full list. So what you need to do is call and email us, and we'd be happy to provide you with information.